To Grant Robertson.
Thank you very much, Mr Speaker. It was interesting to hear the Minister say that the principles that would underlie a good public service policy would be around developing high-quality services that were modern and responsive. And I found myself saying, that's exactly what we need. We need a plan around the delivery of 21st century public services that are responsive to people, that are developed in consultation with those who receive the services and the public servants who develop them. And if we could get that right, we would have a modern and responsive public service. But that's actually not what's in the bill in front of us today. What's in the bill in front of us today is more shuffling around of agencies in the public sector in some kind of vain hope that this represents a plan to actually deliver better public services to New Zealand. The sad fact, Mr Speaker, is that the Minister now, and in the bill that we have in front of us today, the case has not been made for why these changes need to go through. And from the Labour Party's point of view, we cannot support this bill because we don't believe the government has made the case for why these changes need to be made. What they certainly have not done, Mr Speaker, is make the case for how this will deliver better public services to New Zealanders. Because we all want more effective, more efficient, more responsive public services. But the approach that the national government has taken since it got into office has simply been to cut. Now, the Prime Minister actually said cap but not cut public services when the Prime Minister came in. He said we will cap but not cut. But instead, he gone back on his word and said, here we are, 2,000 people have lost their jobs and public services have not got better. Public services have not got better, Mr Speaker. So what we see from this government, rather than a plan to actually improve public services, is just a series of indiscriminate cuts. Mr Guy, I say I would welcome a plan that said, here are how we're going to deliver more effective public services. But that's not what we've seen from the government. What we've seen from the government is cut. We will cut. And actually, this is a government that said it doesn't need policy advice. Bill English told us that he could run government by Google. We don't need policy advice, we'll just get the advice off the internet. That's what Bill English told us, Mr Speaker. Well, that's not going to deliver good quality public services to New Zealand. It's simply going to deliver fewer public servants, fewer programs and fewer services. So the Minister tells us when he stands up that this is about the new public service of the 21st century. Well, it's not, Mr Speaker. It is just the shuffling of agencies while the government goes on with its indiscriminate cuts to public services. If we look at a couple of the examples in the bill, the first of those is around the creation of the so-called Health Promotion Agency. Now, Mr Speaker, at a time when the country and the House is debating one of the greatest public health crises of our time, the abuse of alcohol, this government comes to the House with a plan to get rid of the one agency in government that's actually focused solely on alcohol issues. It's an unbelievable proposition that this government, which claims to be concerned about the harm that alcohol is causing in our communities, its big plan for the public sector, get rid of the one agency that's actually focused on alcohol. But again, the case is not made by the government for why this is the right thing to do. And we look at also that the public health responsibilities of the Ministry of Health will now be folded into this Health Promotion Agency. Well, I can tell you, Mr Speaker, there aren't many people left in the Ministry of Health actually working on public health measures because this government has systematically cut funding from public health. $124 million were taken out of the public health budget by this government. The Healthy Eating, Healthy Action program is basically gone. And the government has got no plan for how to ensure that we keep New Zealanders healthy. That's what public health is about. It's actually about the government supporting New Zealanders to keep New Zealanders healthy. But public health has basically gone from the ministry, and it will now all disappear into an agency that will have mixed priorities, that will not necessarily be able to give the focus to these issues that New Zealanders want. And I challenge the members on the other side who are interjecting. Is alcohol abuse a problem in New Zealand? Is it something that the government should be working on? If the answers to those two questions are yes, why is this government proposing to get rid of the one agency that is actually focused on that work? So, Mr. Speaker, when it comes to the new health promotion agency, the Labour Party is yet to be convinced as to whether that is an idea that will actually deliver good quality public services to New Zealanders. And certainly it will mean that the one agency focused with dealing with alcohol problems in New Zealand goes out of existence. Mr. Speaker, I want to turn for the remainder of my speech to the proposal to disestablish the Mental Health Commission. Now, the Mental Health Commission was due to end its work in 2015. And if we were standing here today saying, well, the good news is everything's done, the mental health blueprint's been fully implemented, mental health policy and systems in New Zealand are going well, then maybe we could agree to it being ended in 2012. But the truth is, Mr. Speaker, that under this government, focus on mental health has declined. There is no longer any kind of nationwide priority or target for mental health, and district health boards have responded to the government's lack of interest in mental health by shifting resources away from mental health. Here in the Capital Coast District Health Board in Wellington, most of the agencies that deliver mental health services in the Wellington and Kapiti communities have had their funding cut. WellLink, the organisation that provides supported housing to mental health consumers, has had its budget cut by a third. It has had to close one supported housing facility on the Kapiti Coast and is looking at closing another one in Wellington City. Mental health is simply not a priority for this government, and closing the Mental Health Commission 3 years early simply signals that mental health is the poor cousin of the health system under this government, and that is wrong, Mr. Speaker, because mental health issues in New Zealand are becoming more and more important by the day. And as if we needed an example, Mr. Speaker, for the lack of attention for mental health, we had it in the House today from Associate Minister of Health, Jonathan Coleman. He decided to avoid answering questions in the House about a serious assault on a family in Auckland from a person released from the acute mental health unit in the Auckland DHB, and he hid behind parliamentary procedure because he said the question of whether he received an email from a member of this family was a matter before the courts. Well, I can assure the House, Mr. Coleman's receiving of the email is not the matter that is before the courts. Mr. Coleman did receive that email last Monday, Mr. Speaker, which told him that this woman and her husband had nearly been killed by a patient who had been released from Te Whetu Tawera, the Auckland District Health Board's acute mental health unit. And the Minister stood up in the House the next day, Mr. Speaker, to say there had been a marked improvement in the way patients are being managed at that unit. The Minister stood up and said that the day after he had received that email from a woman who said she had nearly been killed. The truth is, Mr. Speaker, the Auckland District Health Board's mental health unit is in crisis. The number of beds have been reduced from 58 to 52 because staff do not feel safe in that unit. And this woman and her family have raised concerns, and the Minister has refused to answer them, Mr. Speaker, and I think that is disgraceful. And it goes back, Mr. Speaker, to the fact that mental health is not a priority issue for this government, and the changes being made here to end the activities of the Mental Health Commission are a sign of that in this bill. I want Minister Coleman to actually take some responsibility, explain to the people of New Zealand and the people of Auckland how he will be ensuring that patient safety, family safety and community safety will be assured with the reduction of acute mental health beds, and whether community mental health services in Auckland will get additional resources to deal with the patients who are now being released from the unit because there are not beds for them there. There needs to be some answers from Minister Coleman. He cannot hide behind parliamentary procedure. So, Mr Speaker, the Labour Party will not be supporting the first reading of the Crown Entities Reform Bill. We do not believe the case has been made for these changes. We certainly don't believe that these changes are going to lead to more effective, more efficient public services. They're certainly not going to turbocharge the economy, Mr Speaker. These changes are shuffling around of agencies that will not deliver better outcomes for New Zealanders and therefore should not go through.
Call Kanwaljit Bakshi.
Mr Speaker, I stand to debate on the first reading of Crown Entities Bill. The purpose of the bill is to amalgamate the functions of a number of existing agencies for greater efficiencies in order to streamline bureaucracy and focus on the better public services. This omnibus bill provides for the structural changes on the way that government is organized across the health and charitable sector. New Zealand currently has 38 government departments, over 150 Crown entities and more than 200 other agencies. There are clearly efficiencies to be gained by merging entities or transferring their functions to other agencies. Mr. Speaker, national government has already set up the Better Public Service Advisory Group to provide the support and advice to the state sector minister to help ensure that the changes we make improve results. The group has clearly focused on the value for money, innovation, high quality service, provision and effective change management. We have made pragmatic decisions to merge government departments and agencies with ongoing savings. These amalgamations alone will deliver saving of 92 million over 4 years and ongoing savings of 22 million per annum. Mr. Speaker, we have already amalgamated the Ministry of Forestry and New Zealand Food Safety.
And therefore should not go through.